I'm Kate, an analyst for a health plan that's looking carefully at our finances this year in light of all that's changed in the marketplace. To help us do this, we use software from Milliman. The MedInsight Analytic Platform is a powerful data warehouse and analytic platform for healthcare companies, giving health plans, employers, providers, and public agencies a way to benchmark healthcare spend and quality. It moves you quickly from aggregation to analysis and action in a system that employs the industry's leading healthcare business intelligence methodologies. MedInsight is both wide and deep, with lots of features and functions. Let's look closer. Designed to address specific use cases, MedInsight solutions can be deployed to address specific needs, such as employer group reporting or optimizing care management programs. But what I'm really here to talk about is one of the main reasons we're so enamored with the MedInsight Analytic Platform. It's all about the data, our data, and the level of confidence we have in it. Much the same as with most other health plans, our data has been assembled over time using different methods and standards. It comes from different systems, often with conflicting information. Rather than just dumping all of it into our data warehouse, MedInsight runs it through its data confidence model to make sure the data is clean, accurate, and credible. Using rigorous data validation and audit techniques, the data confidence model can sniff out problems and give us measurable ways to understand our data's quality. The data confidence model kicks in when we submit our data files to the MedInsight data warehouse. Quality feedback begins now with the file intake process. MedInsight runs more than 100 automated audits, which identify possible data issues early on, saving us significant time. But that's just the start. Once our data has been conditionally accepted, the model conducts more than 60 stringent data integrity steps, looking for those hard-to-find issues that might mislead our users and decision-makers. For example, ensuring claims volume is reasonable for our membership, or that services are being delivered at the appropriate setting. Of course, the data confidence model searches for industry-standard coding, compares our results against benchmarks, and ensures that our key business criteria are present and accurate. Sound like plenty? We're not done yet. The process is finalized by two last checks. One by the model to ensure that our business intelligence metrics, such as risk scores, episodes, evidence-based measures, and benchmarks, are credible to use throughout our organization. And finally, a Milliman data certification expert performs a final check on a subset of the data. Then and only then is our data certified as the highest quality. Thanks to the data confidence model, we know that as we're making decisions about pricing, about waste reduction, and about contracts with providers, that those decisions are based on the right information. We can even tie our MedInsight analysis all the way through to our general ledger. Can your organization say that today? My analysis skills are crucial in defining our direction, but those decisions are only as good as my confidence in the underlying data. MedInsight gives me a way to tell my team, this is what's going on, and this is what we're going to do about it. That's the power of the MedInsight Data Confidence Model.